Now we have to discuss about the branches of the brachial plexus. About these branches, the roots they may give the branches, and trunks they may give the branches, but in the divisions there is no branches. Regarding about the divisions, the branches are not coming from the divisions. So here the parts they may give the branches, and big nerves also they give the branches. So here first we have to discuss about the branches from the roots. So here there is a dorsal scapular nerve is there. So this dorsal scapular nerve it arises from the C5 and C5 nerve root, dorsal scapular nerve. It is arising from the C5 nerve root. It supplies to the rhomboides major and rhomboides minor and levator scapular muscle. Suppose if there is an injury to the dorsal scapular nerve, and what happens? And there is no movements, and the nerve supply is disturbed to the rhomboides major, rhomboides minor, and levator scapular. So rhomboides major and rhomboides minor, and their main action is the retraction of the scapula. Retraction of the scapula means the scapula is driving towards the medial side, the retraction. So this rhomboides major and rhomboides minor muscle is present in between the spines and the supraspinous ligament and the medial border of the scapula. At that level, and there is a rhomboides major and minor is there. So this what happens, and there is a disturbance in this nerve in a case of the cervical spondylosis, and what happens, and there is a disturbance of this dorsal scapular nerve, and leads to what happens, and there is a dysfunction or otherwise less function to the nerve supply to the this rhomboides minor and rhomboides major, leads to there is no retraction of the scapula, and so driving towards the medial side of the both scapulae is disturbed. Next is a levator scapular muscle. The levator scapular muscle is arising here. Levator scapular muscle is arising from this superior nuchal line, the lateral aspect, and it is inserted along with the medial border of the scapula from the superior medial angle to the root of the spine of the scapula. There is an insertion of the levator scapula. So what happens if it is constricts and there is an elevation of the shoulder joint? So the elevation of the shoulder joint is disturbed. In a case of the disturbance at the level of the C5 nerve root, in a case of the cervical spondylosis, and there is a dorsal nerve disturbed, there is a distraction of the scapula is not possible, and there is an elevation of the affected side shoulder is difficult. Next is this long thoracic nerve. The long thoracic nerve, it arises from the roots of the C5, C6 and C7. C5, C6 and C7, these nerve roots, they give the long thoracic nerve, and otherwise normal to the serratus anterior. Serratus anterior muscle is here, and the lateral side of the breast forms the floor of the breast, and in the posterior to the lateral side of the breast, and there is a serratus anterior muscle is there. So this serratus anterior muscle is supplied by this long thoracic nerve, And if there is a disturbance in the C5, C6, C7 level, and there is no nerve supply or less nerve supply to the long thoracic nerve, leads to, and what happens if there is any disturbance or injury to the long thoracic nerve and leads to, and there is these movements are blocked. These movements mean, and there is a abduction, and 0 to 15 degrees is maintained by the supraspinatus muscle. From 15 to 90 degrees is maintained by the deltoid muscle, especially, and the muscle fibers which are arising from the lateral border of the acromion process of the scapula. And overhead abduction is maintained by the serratus anterior muscle. In here what happens? From 19 to overhead abduction, and this movement is maintained by the serratus anterior muscle, and this overhead abduction is disturbed. Suppose, and if anybody is combing the hairs and it is not possible in affected site, and because there is a injury or otherwise dysfunction of this serratus anterior muscle, and there is a nerve, long thoracic nerve, and in this type of disturbance we may find in the nerve involvement in the case of the cervical spondylosis. And then this is regarding about the long thoracic nerve. And another one here, there is these two roots, they are arising from these two nerves, dorsal scapular nerve and long thoracic nerve. They are arising from the roots of the brachial plexus. Next is this branches from the trunks. You see here, in the middle trunk, it is not giving any branch. And the lower trunk, this one is a lower trunk, and it is not giving any branches. But only the upper trunk it is giving the branches. One suprascapular nerve, and another one is a nerve to the subclavius. And the suprascapular nerve, it supplies the supraspinatus muscle. The supraspinatus muscle, it is arising and above the spine in the dorsal surface of the scapula. Infraspinatus muscle, it is arising infraspinous fossa inferior to the spine of the scapula. So this, and the supraspinatus muscle, it inserted on the superior surface of the lateral tubercle and the greater tubercle of the humerus. So if it constricts, what happens? And there is a abduction of the arm. So abduction of the arm from 0 to 15 degrees, just now I have mentioned, and 0 to 15 degrees maintained by the supraspinous muscle, and then 0 to 15. 90 degrees maintained by the deltoid. Overhead abduction is maintained by the serratus anterior. So here what happens? And then the abduction of the shoulders is maintained by the especially three muscles. This one is you see, and there is a 0 to 15 supraspinatus, from 15 to 90, and the acromion process and acromion fibers of the deltoid from 90 to overhead abduction, that is maintained by this serratus anterior. So serratus anterior muscle, it has another actions also is there. There is a pushing movement that is maintained by this serratus anterior, and punching movement also that is maintained by the serratus anterior. In a case of the involvement of the dorsal scapular nerve, and what happens is the pushing, punching movement and overhead abduction, these three functions are less or completely absent. So in case of the suprascapular nerve, and it maintains the 0 to 15 degrees abduction. And there is a nerve to the subclavius is there. It supplies to the subclavius muscle. And here one important point is there. You see here there is a involvement of there is a very good it is that is called by the Erb's point. In Erb's point, what happens? There is a involvement of the 6 roots of the nerves. You see here, the superiorly there is a suprascapular nerve, inferiorly there is a nerve root of the subclavius, there is a nerve root of the C5, and there is a nerve root of the C6, and the anterior division of the upper trunk and posterior division of the upper trunk. And these 6 nerve roots, there is a collectively there is a meeting point is there, and that is called by the Erb's point. Erb's point means this one. And there is an involvement of the C5, C6 and suprascapular nerve and nerve to the subclavius and anterior division of the of the upper trunk and posterior division of the upper trunk. And there is an involvement of the suprascapular nerve and this collectively, and it is called by the Erb's point. And I shall draw the diagram here. This one is a C5,